In the United States, 1 in every 8 women will develop breast cancer in their lifetime. This would mean that the average woman faces a lifetime risk of breast cancer of about 12.5%. Based on certain risk factors, one can have a more elevated risk for breast cancer than others, including things like late childbearing after the age of 30 or no children at all, menopause after the age of 55, menstruation before age 12, Ashkenazi Jewish heritage, which happens to be the largest saturation of the BRCA mutation, male breast cancer, having dense breast tissue, radiation to the chest wall prior to age of 30, or having a biopsy in the past that was found to have atypia, such as ADH or LCIS. Women with additional risk factors for breast cancer face a lifetime risk of at least 20% or greater. Cancers in these patients can also be more aggressive and can develop at a younger age, even before the age when screening mammography begins. Risk assessment is important because it helps to identify those with an elevated risk for breast cancer and those who may carry an inheritable mutation that is known to cause breast cancer. It takes just a couple of minutes for a patient to complete a risk assessment just before their mammogram appointment. Patients are provided with an electronic device such as a tablet or an iPad to complete a questionnaire, answering questions relating to risk factors. And it is updated each year as risk can change. Patients are encouraged to prepare for risk assessment by knowing a few key things, one of which includes family history on both the maternal and paternal side of the family, knowing what cancer was diagnosed in each individual and the age of diagnosis for that individual, your menstruation history, your reproductive history. You will also be asked questions regarding lifestyle factors such as drinking history and smoking history. Patients are informed of their risk typically when they receive their mammogram results from their doctor. If you have an elevated risk for breast cancer, it's encouraged that you discuss the risk and recommendations with your physician so that an individualized plan of care for follow-up is created. Screening guidelines can vary from patient to patient based on their lifetime risk for breast cancer. Those with an average lifetime risk for breast cancer between 0 to 15% are recommended to have an annual mammogram starting at age 40, but can be done as early as age 35 based on your insurance plan. Patient with a moderate lifetime risk for breast cancer or those with a lifetime risk between 15 and 19.99% are recommended to have an annual mammogram beginning at the age of 40 or starting as early as 35 based on their insurance, in addition to consideration of a whole breast screening ultrasound if they have extremely dense breast tissue. Women with an elevated risk for breast cancer or those having a calculated lifetime risk of 20% or greater are recommended to have both an annual screening mammogram plus an annual screening breast MRI. These patients are also recommended to have a clinical breast exam every 6 months to be performed by their physician. For those who are not candidates for breast MRI, because they have an implanted medical device that is not compatible for MRI, or if they have severe claustrophobia, they would be recommended to consider whole breast screening ultrasound as a supplement to breast MRI annually. When detected early, breast cancer is one of the most treatable cancers, with a 99% survival rate. Thus, early detection is critical, especially for those who have elevated risk. It ultimately leads to improved treatment and survival outcomes.